Camp of Michigan. Welcome to both of you. Mr. Camp yesterday said in a statement that the tax increases in this bill will ruin our economy and kill jobs. Mr. Yarmuth, how do you react to that, and why do you say they won't?
Well, I have great respect for my friend Dave Camp, but I think he's wrong on this. You know, one of the things we've seen is throughout the country, employer after employer dropping coverage of their employees because they can't afford it. And you know this is having an impact on their hiring ability as well when premiums are going up 30, 40, even 50% in some places. So this is all about jobs. In my own district, we lost 500 positions at one of the hospital companies, and the reason they cited was that people don't have insurance and they aren't using the hospital as much. So we know that reforming healthcare is an important boost for jobs, and it's a necessity to help our employment.
Mr. Camp, let me turn to you. Mr. Yarmuth has put out a statement in which he ticks off many of the things, the numbers of people in his district who he believes will be helped by the provisions of this bill. Are you worried that this law is going to be popular?
No, I'm not, because I think over time it's going to get worse. I mean, I think one of the problems is half of their coverage comes from expanding Medicaid, and we know that Medicaid is a broken system. It's not sustainable in the long term. They're going to get a card, but they're really not going to get the care they need because Medicaid pays so much less that physicians aren't seeing Medicaid patients. The other problem with this is that many of the taxes in here are not indexed for inflation. So, for example, on the investment taxes that will even apply to family residence if it exceeds certain thresholds, isn't indexed for inflation, so more and more people are going to be caught into that tax. They didn't index for inflation the tax on so-called Cadillac plans, yet make an exception that if you're a union member, you get a lower tax rate than if you're an ordinary citizen. And I think there's something fundamentally unfair. So we have a lot to work on to try to fix in this since it has passed. And we're going to have to work on repealing the most unfair and onerous provisions over time, and that's going to be quite a job.
Mr. Yarmuth, Mr. Camp gave you plenty to respond to.
Well, actually, on some of those things, I agree with him, and I don't like the taxing the plans either. And you know, we're the only industrialized country in the world that actually has employer-based healthcare system. So it wouldn't bother me if it did go away. I think it discriminates against individuals and small businesses and helps very large companies and their employees. But that's the system we're dealing with. And I think Dave said exactly the right thing, that this is not a perfect bill. We will be making changes on it as long as either one of us is in Congress or alive. But it's an important first step. It will eliminate much of the hardship that many of our country are facing right now. It'll eliminate a lot of unnecessary deaths. And again, personal tragedies, and I think that's an important first step to make. We will be working on it for a long time.
Representative Camp, regardless of how anyone feels about the outcome, I think you can say that the American public is very frustrated with Congress. You have incredibly low ratings among the American people right now. What can be done, if anything, by all to raise your status above that of lawyers and journalists?
Well, that's a challenge. But look, I think the problem here was that this bill started off from the beginning and was a partisan bill. And when we've done major things like Social Security and Medicare, they've had large bipartisan majorities. And I think it was unfortunate that this, from the beginning, and so the only bipartisan vote you saw last night was a vote against this bill. And I think, and now you're seeing state attorney generals all over the country sue because of the individual mandate. Now they're going to make you buy health care. They're going to tax you if you don't buy it. So I think there are a lot of problems here. It's going to take a lot to sort this through. But I think over time, as this phases in and kicks in, you're going to see the problems with this bill really brought to light. And actually, they will impact the quality of the health care delivery in America in a negative way.
Congressman Yarmuth, we've heard a lot from business people that the uncertainty that was hanging over them because of health care reform kept them from hiring. Now we're hearing from some people that they might not hire because they've just simply learned to do with less, and they will have to have coverage for more and more employees, and that's going to cost them money. On the other hand, they get the tax credit in some cases, depending on the size of their business. So how can you assure the small and medium-sized business person out there that they should hire, given the provisions in this bill?
Well, first of all, any company with fewer than 50 employees isn't even covered and gets subsidies to help them. So you're talking about 95 or 6% of all the small businesses can only benefit. They cannot possibly be penalized in any way by this bill. So I think business people are going to find it a huge boost. I ran a small business. I had 20 to 25 employees, faced the same problems that people do now. You get one sick employee and your rates go up 20, 25%.
But do you see, Representative Yarmuth, how when you do that, it actually puts a disincentive to growth? If you've got 49 employees, you're going to think really, really hard about hiring that 50th. I mean, to really grow, the hurdle gets much, much higher because you are going to bear far higher costs.
Well, actually, it doesn't work quite that way because the first 30 are exempted, but there is going to be a cutoff point at some point, and that is a valid point. At that threshold, you're going to have to. But I don't think most companies think of that size. When you get over 50 employees, they're thinking about hiring 1 or 2 people. They're mostly thinking about hiring 10 or 20, and that means their business calls for it. So I'm not sure that's as big a problem. It might be a problem on paper. I don't think in the real world it's that big a problem.
Representative Camp, I assume that there must be parts of this bill, even though you rejected it or you voted against it, there must be parts of it that you like. Can you identify 1 or 2 things that you think actually are good results?
Well, in the beginning of the bill, the way they deal with pre-existing condition for the first 4 years is exactly the way we dealt with it in our bill, which was reinsurance pools and state reinsurance and high-risk plans. So we actually had the same provisions on pre-existing condition for 4 years. Then they flipped to a total ban, an individual mandate, and then the tax and all of that. The other thing we had in common was we both prevented insurance companies from annual or lifetime caps on policy limits. So both proposals were very similar on that. I think probably the big difference is ultimately when you get to the end, our bill was scored as actually lowering insurance premiums, and because they have a command and control, a federally defined benefit plan, that is going to be more generous and that is going to cost more, and actually in people's premiums are going to go up under their plan. So that's probably the biggest difference. But on those 2 key points that we heard a lot about last night, in the beginning years were actually the same. Then they change as they phase into other more.
Gentlemen, thank you very much. I know it was a long night last night. We appreciate you being with us today.
Our pleasure.
Thanks a lot.
Thanks.
As we continue on Power Lunch, the